Welcome to another edition of Journey of Hope. Stories of people who share their journey. People that come here to Loma Linda seeking hope and healing and happiness and wholeness. Our special guest today is Walter Deege from southwestern Washington, originally from Holland, and has an amazing story of not only having cancer, but having 6 different types of cancer. Walter, it's good to have you here. We've got people from around the world that are watching, and we want to learn a little bit about you. I've already indicated you're from Holland. When did you come to this country?
I came here in 1955 when I was 18 years old.
All right, and I understand you had a degree when you came here.
Yes, I had a degree in mathematics.
Degree in mathematics from Holland?
Yes, from Holland.
Okay, and then you eventually came here to California, and did you go to school here?
Yes, I did. I went to SC, Open Exposition Boulevard.
USC?
USC,
okay.
Yes. And I also did some part-time work, and until I got married.
All right. So now, what did you take at USC?
Engineering courses.
And
okay, a mechanical engineering degree.
You got a degree in mechanical engineering.
Mm-hmm.
And then as we were visiting, I learned that you actually went on and did some more work and got a
law degree.
A law degree. Okay. Then what kind of work did you get involved in?
I was involved in aerospace. Worked for companies like Transco, Rentec, Minnesota Mining, Emerson Electric, government type stuff, where I was a program manager. Worked with various contractors such as Rockwell, Raytheon.
Well, you had really a broad background. Well, then, how did you end up in Washington?
About 25 years ago, my wife and I decided we'd had it. We were
down here in the LA area.
We were living in Thousand Oaks. We had moved there when Thousand Oaks had about 10,000 people and grew to about 100,000. And we were just getting sick and tired of the hot sun beating on the cement.
Right.
Okay, and having no green trees or things like that. We owned some businesses, we sold them. We took one business up with us at the time, and we just started looking, and we had friends up in Astoria. We couldn't find a place there, so we saw an ad in the paper. We went across the river into Washington, saw the place that was being advertised. It took us about 5 minutes just to do a handshake deal, the old-fashioned way. Like, I want to buy and you want to sell.
That's when your word was your bond, huh?
That's correct.
Yeah.
And we bought the place, and about 3-4 months later, we moved.
You moved there. Now, you were telling me that you were working with a Lutheran organization for a period of time.
Yes, I worked for a company called Aid Association for Lutherans.
Uh-huh.
Okay, financial planning and financial organization, not-for-profit. And I retired from them when I was 65 years of age, okay, in 2002.
Well, what the audience, and I'm really interested in learning, is, I heard and you shared with me that you had some cancer in your background, in your family.
Yes.
Who's had cancer in your family?
Well, first of all, my mother had cancer. She died at age 47.
At the age of 47?
From bone cancer.
Okay.
I don't know the name of it. It was a very painful experience for her. My son, he's had melanoma cancer.
Okay.
My wife has had both breast cancer and parathyroid cancer. Parathyroid was just last year.
Okay.
And I myself have had 6 to 7 different cancer experiences.
6 to 7. Plus, you have a sister that you were telling me about.
Yes, I have a sister that has incurable liver cancer at this point, and I visited her yesterday in Thousand Oaks, California, and she informed us that the doctor had told her that she's lived 3 days past the times they said she was supposed to die.
So she's got incurable liver cancer, and apparently just indicated that she'd lived a few days already beyond what they...
But she's going to stay alive, okay, because she has a deep faith in the Lord.
Okay,
that's all it takes.
I want our listening audience to hear that again. She has a deep faith.
Right.
And you've got a conviction because of that faith. The Lord's going to continue to guide and direct.
I know He does.
Yeah. Now, let's go back to when you got first started with your role here in cancer. If I remember right, it was back in 91? 1991.
That is
Tell
correct.
us what happened.
In 91, I had tremendous pains in my stomach, etc., and I went through a bunch of CAT scans, and they found out I had between 8 and 10 pounds of malignant cancer in me.
8 to 10 pounds of a malignant cancer inside
Yes.
you. Wow.
And what it was is they took half my small intestines out. They took all but 12 inches of my large intestines out, and it was all cancer, malignant. And I went through something I don't like. I didn't like it at all. This was called chemotherapy. It was terrible. To the point
But
where,
that was what they were prescribing as a follow-up treatment.
After the surgery, I had to do that for 8 months. It was a horrible experience.
But you made it through.
Oh, certainly.
Certainly, of course.
I mean,
just a little kind of a bump on the road. I'm here today. Yeah, it was horrible, but I'm looking back on it. That was a number of years ago.
That's
So
right.
that was in 91. But it didn't end there. And I really, there's people that are watching right now, Walter, that just this week have learned that they were diagnosed. And I need to point out, as I often do to our listening audience, that it's a diagnosis. It's not a death sentence.
That's right.
It's a diagnosis. So a little while after you'd taken care of your colon cancer, then what was your next episode?
No, I had a number of them, but the next big one was my liver cancer.
You had liver cancer.
Okay, I was diagnosed with a liver cancer, and I was given 2 to 4 months to live.
Okay.
My wife keeps saying it was 6 to 10 weeks, but I say it was 2 to 4 months.
2 to 4 months.
To live.
They put a time frame on it anyway.
Oh, yeah.
2 to 4 months. You're in the doctor's office. They inform you got 2 to 4 months.
Yeah.
So if I remember the story correctly, you and your wife went out in the car, and she says,
No, there was one other thing that happened before. The doctor gave me an option. He stated, do you want surgery? Because I can prolong your life to maybe up to a year.
With the surgery?
With the surgery, but you'll have issues.
okay.
Okay, so the wife and I were in a car driving home. It's a two-hour trip from Oregon Health Science University. That's where I was diagnosed.
Sure.
Okay, Dr. Fletcher, the head oncologist, handled me personally. We were driving home, and my wife says, "What do you want to do?"
And she's asking you, what do you want to do?
Right, what do you want to do? I said, no, I don't want to do surgery. Okay, so what do you want to do then? I mean, you only have 2 to 4 months to live.
What are you going to do?
Yeah,
What do you want in the 4 months? What are you going to do?
I want to go fishing in Alaska. I love to fish. Had never been to Alaska, so I wanted to go fishing in Alaska.
Okay.
So I did. I had a friend of mine who was a retired pastor. I called him up and I said, his name was Hugh Wood. I said, Huey, I said, how would you like to go to Alaska go fishing? And he has children there that live there in Petersburg, and I know the kids very well. I said, maybe we can stay with them for a week or so. And he said, I'd love to, Walter, but I just can't afford it. My wife and I had already decided that because retired pastors don't have a lot of money.
You already talked it over.
Okay, so I told him, I said, don't worry about it. I have 2 tickets to go. I didn't have any tickets yet.
Right,
He says, for when? I said, for tomorrow. So he called his kids, called me back 5 minutes later. He says, oh, we can go. What time is the plane leave? I said, I'll let you know. I got to dig out my tickets. So we made the reservations. And the next day we flew out of Seattle. We went up there. Okay, his son-in-law had a 15, 16-foot skiff, a little boat. And I've owned boats all my life, so I was not worried about running a boat. And it was a little 75 horsepower Evernote motor. I'll never forget that thing because it was a heavy motor for a small boat. And we went fishing. And the third day out, my friend was sitting in the back with his life vest on and everything else. And I was wearing hip boots, which you don't do in a small boat. Okay, my life vest.
You're in southeastern Alaska,
Right,
there's glaciers around.
Yeah, and my life vest is laying off to the side of me. Okay, it's just sitting there. I'm the smart boatsman,
Sure.
Instead of putting it on, no, I left it there because I knew I could grab it if something happened. And my friend says, Walter, I think we're sinking. I look around, I see spouts of water coming up through the bottom of the boat.
So you're way offshore,
Yeah,
3 or 4 miles
about
out.
5 miles out.
5 miles out.
5
And
miles out.
he said, hey, we're sinking.
Yeah.
Water's coming in.
So I turn around, I'm trying to get the throttle, get the boat up on the step. The engine just died, went zip, and the boat went upside down, and there was a little air pocket in the bow of the boat. My life vest was going out there. I didn't grab it.
The boat's going down, the preserver goes out.
So I grab
Hang on to the boat.
The boat. I'm wearing hip boots. They're filling up with water. Okay. They're pulling me down, 4 layers of clothes, no life vest. I was in the water up to about here. And then, or actually to about here. And then this was out of the water totally, because I was holding on to the boat. And there were no boats around me, anywhere. And I looked because we'd passed all the boats a long time ago that were fishing out there. Out of nowhere, 5 or 10 minutes later, comes this boat. I said, where have you come? Where did you come from? Oh, we saw this happening. I said, no way. And I'm arguing with these guys while I'm hanging onto the boat. I'm arguing with them. And I said, there's something wrong here. So I said, go and find my friend. Oh, you have someone else with you? I said, yeah, he has a life.
He's floated off.
Yeah, he has a life vest on. So he said, go get him. He's older than I was and everything else. So, I was concerned for him. So I said, go get him. They said, okay. But the waves are about 2 or 3 feet, so it was hard to find him, I guess, because they left me. I was attached to that boat almost for 35 minutes. But the thing that happened after they'd gone for about 5 or 10 minutes, my chest started really hot, and it was a great feeling. Okay, and it was a gray sky. The rain was coming down. And I looked up and I said, Lord, if this is it, this is it. That was it.
You're hanging on for dear life.
I felt good about it. I knew I was dying.
You're at peace, though.
Yeah, I was totally at peace. I grabbed hold, and then I passed out. Totally.
Hanging onto the boat.
Yeah,
just a little bit above the water.
Yeah, passed out. So they came back and they couldn't pry me loose.
You're frozen to the boat.
My hands were frozen to the gunnels of the boat, and so they had to wait for another boat to come, and there were chunks of ice floating around us because this was the beginning of May. Okay, in Alaska, there's ice on the water there. And they took me, 3 guys
pried me off.
The skiff that I was on, 30 seconds later, went down 150 feet. It held me until they took me loose. And I went down. They got me into a boat with some kind of wood stove and stuff. They took my clothes off, everything. There was the ambulance for me. I don't know any of this.
Sure.
And then I wake up the next morning in the hospital.
Don't know where you are.
I said, where am I? Then I started remembering things. Wow. So then the kids brought my clothes down. I got out of the hospital and went fishing again the next day. Okay. For 3 more days. Then went home. And then what happened was the doctor called, I talked to my wife, said, is Walter going to do the surgery? And my wife says, no, he doesn't want this. She says, no, I think we need to talk to him and have him come up. So she set up an appointment. So about a week after I'd gotten home, we went back up to OHSU, that's Oregon Health Science University. And we said, okay, let's take some more CAT scans to see if there's anything else we can do. And they had taken biopsies before from the first set of CAT scans and all the other things, and they had the big tumor shown. And so they put me on one CAT scan machine. 5 minutes later, they said, why don't you get off that one? And we got a problem with that machine, so go on to the other one. There was another room we had to go into. And 5 minutes later, they came back and said, we got a problem. And they had the pictures from my previous scans hanging on the wall. And they had the other pictures. There was a screen down where they were looking at it. And they said, we can't see the tumors anymore.
The tumors were gone.
Yeah, they said, and the Dr. Fletcher, who is an atheist all the way, okay, totally, he says to me, Walter, what did you do? And I'm looking at him like he's nuts. What did I do? I didn't do anything. So my wife says, I said, nothing. My wife says, why don't you tell them what happened in Alaska? Okay. And by the way, the Alaska story was all printed in the newspapers too out there. Yeah, I got copies of those.
So you told him about the Alaska
experience? So I told him about the Alaska experience, and he says, that's it. I said, what? He says, your cancer was frozen. Was killed. I said, wait a minute. So what do you mean? He says, we know when you freeze cancer, you can kill the cancer. He said, we do it all the time with some cancers. We freeze it. So I'm dumb. I said, no, why don't you freeze everyone's cancer? Get rid of it. He said, we can't, because we'd kill the person.
Lose the patient.
Because there's such a finite distance between life and death.
Yeah. But it takes it right down.
Right.
And
And he said,
very
we can't do
critical
it.
point.
We'll kill him.
So there's
So-
no sign of cancer at that
No.
point.
So he
living.
says to me, so I said to him, I said, if that's the case, I said, you know how powerful my God is? He kept me in that water long enough to cure my cancer and short enough to keep me alive. And he, the biggest atheist in the world, says to me, it's the only answer.
That's
Just like
what
that.
Unbelievable.
And there were 15 people around it.
What an unbelievable testimony. What a powerful story. God was not through with you.
No.
Now, after that, very quickly, tell us some of the other things that have happened because, it's one thing after another.
You want me to tell them what I have right now? Or what I...
No, we'll get to that in a minute.
All right. Now, I had a hernia surgery afterwards, and when they got into me, they found another tumor that they took out.
Okay.
So they just cut it out and said, no, we found it, we think we got it all, that was it. Okay, then I had prostate cancer.
And that's when you came to Loma Linda.
That's when I came to Loma Linda. I had a good friend of mine had gone to Loma Linda. Okay, and the surgeons wanted to cut me open and take it all out. And I said, no, I've had too many clients in the business I've been in that I saw that had done it, became babies afterwards. I said, no, I don't want to do that. So, so I found out about Loma Linda. They accepted me. I spent 2 glorious months here. They were
That's now
fantastic.
being treated for cancer,
I
2
played
glorious
golf.
months.
I played golf every day.
And proved your golf scores, what you're telling me.
Right.
But you had something else done while you were here.
Yes, I had macular degeneration. I was blind in one eye totally, 100% blind. At the Casey Eye Clinic at OHSU, they had done 3 laser surgeries on me. Could not do anything about it. They had scarred my eye, and it was just totally black, my left eye. I looked, I closed my good eye, I looked at my left, it was a black, nothing. I went to a session on Wednesday night down here where all the patients are.
Or Wednesday night educational
Yeah,
support
they
group.
bring them in and they give us sandwiches and stuff, and okay, make it feel good. And they have different people talking. And there was a Dr. Yamamoto was there, and he was giving a lecture on macular degeneration, how proton treatment started, researching the macular degeneration and how this evolved into what it is today. And then he's talking there, and he says, wow, I said to myself, he's talking about my eyes, So afterwards I said to him, doctor, I would like to see you. He said, why? I said, oh, I have macular degeneration, and I've had 3 laser surgeries, nothing can be done about it. It's a dry kind, and he was talking about the wet kind that they could fix. I have the dry kind. I said, I'd sure like to see if there's...
It would work.
Yeah, he said no. So he set me up the next day with an eye doctor. It was a medical doctor that all he do is they look at eyes.
Ophthalmology.
Yeah, and he works very closely with them, and they spent 4 hours testing here near Loma Linda. Then he took he gave me all the pictures. They go back to see Dr. Yamamoto, and they had already spoken, and then Dr. Yamamoto said, well, we're going to try it. Can't tell for sure, but we're going to try it. There's hope. And he says, you have to make a special mask for your face, which they did. Next morning, Dr. Yamamoto put that big, huge, it's like a gun.
Yeah, it's where the beam comes in.
Okay, a big thing. And aimed it at me, and it took about a second, I think, real fast.
Very short.
And he says to me, no, it's all done. I said, wow.
One treatment.
Yeah, 1 treatment. I said, no. I said, I don't see any difference. Still black. He says, you won't. It takes time. So about 2 weeks later, I started seeing gray instead of black. About 2 more weeks after that, it was right at the end of my stay here at Loma Linda, I started seeing some vague things, like movements.
Sure. Beginning to see some things.
Yeah, like shadows type things. It took about a full year almost, and right now today, my depth perception is back. I can play golf with both eyes when I putt. I mean,
wow.
And I can see, I can cover my good eye. And this one is still bad, okay? It's not perfect.
But
I'll tell you what, if this eye ever goes bad, I can drive with this one if I need to, and that's how I look at it.
Well, you're telling me you can sink putts 20 and 30 feet long.
That's right.
You're seeing all right.
Yeah, so.
Well, that is an amazing. So you were here, you got 2 for 1 then while you were here.
I sure
you had
did.
the prostate taken care of, and you had your eye taken care of.
Right.
All right. Now, I'd like to tell the group that the listening audience here that everything kind of came together and everything was in the past, but no, not so simple, is it? You've had a couple of other things. In fact, right now, currently, what are you facing?
Can we go back to 2008 first?
Yeah.
2008, I got diagnosed with kidney cancer.
And kidney cancer.
Right.
Okay.
They took a kidney out of me.
Just a couple years ago.
Yeah. 2008, March 14th, 2008. I'll never forget that date because this should never have happened to me, I say. Okay, but it happened.
So, kidney cancer, what did they do?
They removed the kidney. That was it. No.
I mean, a simple little thing like a tonsillectomy. Took the kidney out.
They took the kidney out, and I was home for a week and went back to work again, or 2 weeks, whatever.
Oh, you're something else.
And then I got diagnosed about 2 months ago with, and they've known this since 2004, which I didn't know about. They just found out by checking records, is that I had a spot on my lung, and that just in the last 3-4 months has grown to twice the size. And they say this could be cancer also now.
So there's a possibility. They've spotted this thing on your lung, and in the last couple of 3 months, it's doubled in size.
Right.
So the next steps will probably be doing a biopsy.
Yeah, I have another test scheduled in November, and then probably a biopsy, and we're now checking where all the...
You're going to see what your options are in terms of what's the best way to treat. And, proton is one of those possibilities. We need to, look at all the specifics. Walter, you are an amazing person that's been on a journey. I mean, one thing after another. And where's the Lord in all of this?
I'll tell you what, I will live to be 100 because as long as I can help people, He's
You're
going to
live
keep me alive.
To be 100.
No, He's going to keep me alive, okay? The thing is this, that I know that all my experiences with cancer, it's for a reason, okay? I can talk to people that are down and out and try to lift them up and help them. And I've spoken to, I've done programs in my business where I have people that have had prostate cancer or cancer. They come in and we sit in the conference room and I show the videos that I have from Loma, I go through the books. And a number of them have come down here, have been helped. And I really think that, when a person helps others, God is going to keep them there.
So you're looking at this as an opportunity almost to do ministry in helping other people. And other people come and say, I got cancer and I don't know what I'm going to do. And then you begin to tell them, well, is that all you've got? Just one little cancer here? And then you begin sharing. But no, you have an attitude and a desire to help other people.
That's right.
And God is certainly not through with you yet.
Oh, I know that.
I mean, he's got some wonderful, wonderful plans. You're almost like the bionic man, $6 million man. When I say that, all the different things that you've been through, all the changes that you've undergone. But God still got plans for you.
I'm still healthy. I'm still healthy.
I've got a little bit of lung cancer maybe, but I'm still healthy. I'm missing a kidney, but I'm still healthy. No, you're right. God is going to use you to His honor and to His glory. He's going to bring you into contact with people. There are people that are watching right now. In fact, there's people watching right now, Walter, that just this week they received some kind of sobering news. What would you tell them?
First of all, thank the Lord that you found out about it now.
All right, that's a wonderful point. When they're diagnosed, you thank the Lord that you found out. They already had the problem. Now they know, so they can do something about it.
You've got to do that.
So thank the Lord.
And then you pick up the phone and you determine what the best options are, and you follow the option. I mean, if it's Loma or whatever it may be, okay. Like my wife, and she had the parathyroid. Okay, we found out that the doctor had done 10,000 plus surgeries, had a 99% success rate, and he was in Florida, and the ones in Washington had a 50% success rate. Guess where we went? We went to Florida.
So your counsel is find somebody that's experienced and get a second opinion.
You're darn right. You've got to.
Very, very important. Get a second opinion.
Yep.
Okay, any other counsel? I mean, there's people that are, they're kind of stymied and they're not sure what they're going to do.
Now, one of the things that they need to do, they need to be open about, open about the issues, as far as, you have lung cancer. Okay, now let's find out who has had lung cancer. What have they done? Talk to other people in the same boat. Okay, find the success stories. Don't find the story of the person who says, I have cancer, they sit in a chair, they watch TV and they die.
And they're waiting
Yeah,
to die.
don't do that. God didn't tell you you got to sit down and give
Find
up.
people that have encountered it,
Right.
that have overcome,
Certainly.
and looked at the, that's wonderful counsel.
It has to be. Okay, that's what I've done, and it works. Okay, and at the same time, know that everything is given to you by God. And there's nothing that you do yourself.
Yeah.
Okay?
Realize that you have options.
Oh, yeah.
Yeah.
You have lots of them. I mean, to me, life is wonderful, okay? But, you know, God makes it wonderful.
All right, say that again. Life is what?
Wonderful.
Life is wonderful. Here is a man that's been through one thing after another and is still able to say, life is wonderful. Because, you know, God's in control.
Mm-hmm. I love it.
He's got plans for you.
You know, the nice part about this life, like, I live an hour and 15 minutes away from my office as far as in Washington. And it's a road with very little traffic. It's about 60 miles. It gives me an hour and 15 minutes to talk to him and to look at the beauty and everything that he creates. And I know even, and we have a lot of rain out there, I see all these clouds in the skies. And they're beautiful. And I know he created them.
Yeah,
okay, and he's keeping me alive to witness all of this. Okay, and if anyone and everyone, okay, understood that, what he's creating, okay, we'd all be living forever.
We're coming down to the end here. Walter, you have been an inspiration to me. I know you're an inspiration to the listening audience here. For those that are looking on, I'm Lynn Martell with Journey of Hope. And again, Walter is a wonderful illustration of a person that's not only a survivor, but a thriver. Give God an opportunity with your life. Just now, turn to Him. He'll open and close doors for you. Till next week, God bless you.